Dr. Nicholas Mercer, the theme park therapist with You Improve PT. I'm going to show you my 3 favorite exercises that you can do inside the theme parks like Disney and Universal Studios that will help decrease lower back pain and leg pain that's often caused by herniated discs. My goal is to make your theme park experience as amazing as possible. So join me as I go over the basics of this condition and show you what you can do to improve your pain, because pain is not magical. So you've been told you have herniated discs in your lower back. Don't worry, you're not alone. There's so many people walking around Disney, doing their everyday activities, and yes, even exercising with this diagnosis, and they don't always have pain. But chances are, if you know you have herniated discs, then you're probably already experiencing some back pain or leg pain known as sciatica. This pain most likely keeps you from walking for a long time, standing for a long time, or even sitting for a long time. Basically, it keeps you from enjoying your theme park experience to its fullest. It might keep you from walking around the parks, standing comfortably in line, or even sitting down for like a 30-minute show. This pain can even be irritated by some of the more aggressive rides you run into. Rides like Big Thunder Mountain in Magic Kingdom, The Mummy in Universal Studios, or Dinosaur in Animal Kingdom. As a doctor of physical therapy, I treat patients with herniated discs pretty frequently. The exercises I am about to walk you through are designed so that you can easily do them while you're in the middle of your theme park adventure, right inside Disney, right inside Universal. This way you can get some immediate pain relief and continue to walk, stand, or sit, which will ultimately allow you to get more out of your theme park vacation and keep going and having fun. Now, before we get into the specific exercises, it's important to know just a little bit of what's happening in your lower back when you have a herniated disc. Don't worry, I'll keep this quick. A normal disc is kind of like a jelly donut. If you injure the jelly donut, the filling pokes out and can often hit one of the nerves in your lower back. Most often, the nerve that gets hit is the sciatic nerve. Sciatica, or shooting pain down the back of your leg, will occur when the jelly from the donut hits the nerve. Normally, you'll get pain and some numbness and tingling, which can go all the way down to your foot. All right, come back now, class. The boring part's over. So, these exercises are not a replacement for a thorough physical therapy evaluation and plan of care for your specific issues. While the exercises I am about to show you are in no way intended to fix the problems that are going on inside of your lumbar spine, they often provide some amount of immediate pain relief to people with herniated discs and sciatica. And that's important when you're in the middle of your theme park vacation and start having an increase in pain. So, without further ado, exercise 1, lumbar extension. When you flex your spine forward, the jelly in that donut gets a little bit closer to the sciatic nerve and is more likely to irritate it or put more pressure on it. So, the fix for this is to repeatedly perform extension in the lumbar spine, as you can see in the video. You can do this exercise while standing or sitting. Simply perform 20 to 30 small oscillations back into extension. Do this throughout the day, especially when your pain is increased. If your leg pain starts to recede back up into your lower back, that's a good thing. Also, if you are not comfortable performing this exercise or any of the exercises in a crowded area or around a lot of people, simply perform them when you use the restroom. It's also a good opportunity to take a look at yourself in the mirror and make sure you're doing the exercises correctly. The next exercise is decompression breathing. In this exercise, we are working on activating the deep core muscles that are located in your stomach and your lower back to help stabilize the spine. The taller you get, the better. Simply breathe in as much air as you can and think of getting the back of your spine up and the top of your head to, well, as Woody from Toy Story would say,
reach for the sky.
As you breathe out, think of keeping that height you just gained, sucking in your belly button, and getting all of the air out of your lungs as much as you possibly can. Do this for 5 breaths. You should feel muscles in the front and back of kind of your lower torso contract. This is a great exercise to do when you're in line waiting for your favorite ride, like the Velocicoaster, which just opened in Universal. Finally, we have the hamstring stretch. Everyone's told you, you need to stretch your hamstrings, you need to stretch your hamstrings. So I'm here to tell you, you probably need to stretch your hamstrings. While not necessarily supported in the research, many of my patients have found a lot of relief from their back pain and other symptoms caused by herniated discs by performing the hamstring stretch. This exercise can be done either sitting down or standing. Simply bring your leg in front of you, straighten out the knee, point the toes up, and lean forward from your hips. Try not to round your lower back. Think of your chest going forward and your butt going backward. Hold this for about 30 seconds, then do the other side. You should feel a stretch in the back of the leg that's straight. Do this throughout the day when waiting in line or sitting down to have a snack. It should give you some pain relief after walking for so long around the theme parks. Remember, with sciatica caused by herniated discs, we want the symptoms to come up your leg closer to your spine. This is a good sign that that exercise is right for you. With that being said, thank you so much for watching. I hope these exercises help you on your next theme park adventure. Please subscribe down below so you can get more videos like this to help improve your overall theme park experience, because pain is not magical. So you've been told